We wanted to welcome everyone tonight and thank you all for registering to participate in this important topic on teen emotional health. I'm Octavia Marsh, the Executive Director of Hanover Cares Coalition, where our mission is focused on youth substance use prevention. We know that substance use and mental health are often co-occurring disorders, and we're pleased to be part of this discussion tonight. Tonight, we have Felicia Baez, Behavioral Health Wellness Specialist at the Hanover County Community Services Board, as our technology moderator, and she'll help to manage the Q&A and the chat box features. Tonight, we have an incredible panel of speakers lined up for you, including Grace Gallagher, Executive Director of the Cameron K. Gallagher Foundation, Honesty Liller, CEO of the McShin Foundation, Laura Robertson, Behavioral Health Wellness Specialist with the Hanover County Community Services Board, Maren Scalone, ACES Community Program Admin Specialist with the Department of Behavioral Health and Developmental Services, and Kim Sterling, Intervention Counselor with Hanover County Public Schools. These panelists will cover topics on emotional health, including depression, suicide risk, lived experience, self-care strategies, resilience, and resources. Each panelist will share for about 15 minutes, and we will have one video recording from a panelist who could not physically be on the session tonight. We'll have a Q&A discussion at the end, so please submit your questions throughout the presentations using our Google form link, which will be shared in the chat. All questions that are submitted are anonymous, and we encourage you to ask questions and engage our panelists who've graciously provided their time tonight for this important discussion. At the end of the webinar, we'll also provide you some resources and share an anonymous evaluation link to gauge your feedback on the event in order to help us continue to provide content that's relevant and valuable to your family. This webinar is being recorded and will be available to view later on YouTube, and there will also be a Spanish translation recording available on YouTube, and we will not have a live translation during the session tonight. We'll also be sharing all slide presentations from tonight with registrants, along with the evaluation and resources shared. Felicia, next slide, please. As a public health professional and one who works toward the prevention of youth risk behaviors, I'm pleased to see the U.S. Surgeon General, Vivek Murthy, issue an advisory just in December 2021 focused on protecting youth mental health. I'd like to share an introductory excerpt from this resource to orient you to our focus and reason that we're all here tonight. I also want to encourage you to explore this resource further following our program for tangible and actionable information that you can do to help keep teens safe. This is the introduction from the Surgeon General. Every child's path to adulthood, reaching developmental and emotional milestones, learning healthy social skills, and dealing with problems is different and difficult. Many face added challenges along the way, often beyond their control. There's no map and the road is never straight. But the challenges today's generation of young people face are unprecedented and uniquely hard to navigate. And the effect these challenges have had on their mental health is devastating. Recent national surveys of young people have shown alarming increases in the prevalence of certain mental health challenges. In 2019, 1 in 3 high school students and half of female students reported persistent feelings of sadness or hopelessness, an overall increase of 40% just from 2009. We know that mental health is shaped by many factors, from our genes and our brain chemistry to our relationships with family, friends, neighborhood conditions, and larger social forces and policies. We also know that too often, young people are bombarded with messages through the media and popular culture that erode their sense of self-worth, telling them they're not good-looking enough, popular enough, smart enough, or rich enough. That comes as progress on legitimate and distressing issues like climate change, income inequality, racial injustice, the opioid epidemic, and gun violence feels too slow. And while technology platforms have improved our lives in important ways, increasing our ability to build new communities, deliver resources, and access information, we know that for many people, they can also have adverse effects. When not deployed responsibly and safely, these tools can pit us against each other, reinforce negative behaviors like bullying and exclusion, and undermine the safe and supportive environments that young people need and deserve. All of that was true even before the COVID-19 pandemic dramatically altered young people's experiences at home, at school, and in the community. The pandemic era's unfathomable number of deaths, pervasive sense of fear, economic instability, and forced physical distancing from loved ones, friends, and communities have exacerbated the unprecedented stresses that young people already faced. It would be a tragedy if we beat back one public health crisis only to allow another to grow in its place. That's why I'm issuing the Surgeon General's advisory. Mental health challenges in children, adolescents, and young adults are real and they're widespread, but most importantly, they're treatable and often preventable. This advisory shows us how. To be sure that this isn't an issue we can fix overnight or with a single prescription, ensuring healthy children and families will take an all of society effort, including policy, institutional, and individual changes in how we view and prioritize mental health. This advisory provides actionable recommendations for young people and their families, schools and healthcare systems, technology and media companies, employers, community organizations, and governments alike. Our obligation to act is not just medical, it's moral. I believe that coming out of the COVID-19 pandemic, we have an unprecedented opportunity as a country to rebuild in a way that refocuses our identity and common values, puts people first, and strengthens our connections to each other. If we seize this moment, step up for our children and their families in their moment of need, and lead with inclusion, kindness, and respect, we can lay the foundation for a healthier, more resilient, and more fulfilled nation. I'm just going to wrap up with this last slide. Tonight, we just want to emphasize our why, and we're here tonight to reduce stigma. This is an excerpt again from the Surgeon General's report, and just to emphasize the data and the statistics to bring us together. And this is what we're going to talk about tonight with all of our panelists. And then this is just a graphic, just to orient you all to what our young people are facing. We live in a technologically advanced society and culture. And so again, reducing stigma is our focus for tonight. And so I'd like to open up with our first panelist of the night, Grace Gallagher.